Welcome back to On the Beat, everyone. Isaac here hosting again. And this week we have with me from Baptist Medical Group Columbus Children's Clinic, that is, Dr. Andrea Morris. Dr. Morris, thank you for spending some time with us this morning.
Thank you for having me.
Sure thing. So this morning we're talking about mental health and specifically focused on children or adolescents in your case. Mental health, obviously a huge thing to talk about, really not age specific. Impacts basically everybody. But today, again, we're focusing on adolescents. So speaking of that, why is it so important for our teenagers?
Well, okay, so your mental health is, focused primarily on your psychological, your emotional, your social well-being. And, this is how we all are able to relate to others, how we handle our day-to-day stresses, and how we even make healthy decisions. So, that's why it's so important. And so now we're starting to see a rise in suicide in our country. And primarily during the COVID-19 pandemic, we saw a rapid rise. And that's among our adolescents. So, we're seeing about 25% of the deaths that occur in adolescence is due to suicide. Mm-hmm. And now suicide is the second leading cause of death among adolescents. So it has become a national emergency.
Sure.
Mental health.
A very sobering, statistic to hear that. So kind of piggybacking off of that a little bit, what do you think is the leading cause for this abrupt change? You said the COVID-19 pandemic, but what are some other sources maybe for some of this negativity to enter adolescents' minds?
Well, there's so many triggers to, problems with mental health. You have the social isolation, you have that we experienced with the pandemic, you have social media that can affect your social and your emotional health, you have the abuse, whether it's physical, whether it's emotional, verbal abuse in children, the violent behaviors that children have experienced and witnessed, and just illnesses, the kids get sick too.
Yeah.
You have the chronic illnesses. You have just natural chemical and biological changes that can happen in the brain. And then you have the kids that are just kind of dabbling in that substance abuse.
Yes,
so,
for sure.
All those things can trigger.
Yeah, and you mentioned social media, a lot of negativity. I feel like a lot of kids out there comparing themselves to others, and I'm sure that's sort of a situation you see a lot.
Yes, and bullying happens a lot on social media. So
that leads us into the next question about the signs. You would say bullying would be certainly a sign that you would look for. What are some others maybe?
Yeah, so some of the signs. There's some obvious signs of depression. There's the kid that is probably not eating a lot, or the kid that's eating a little bit too much, gaining weight, losing weight, sleeping too much, not sleeping enough, and you just have like the other really obvious ones that are just like, oh, you have the moody teenager that's just cranky all the time.
Yeah.
You have
so one or two of those days maybe are normal, but anything more than that and the pattern starts to become concerning. So
exactly.
For mom and dad, anyone out there, if they see these signs, where should they go?
They should go to their local doctor, their trusted pediatrician, their trusted PCP. And the kids should feel like they have a trusted adult to go to. They should, whether it's mom or dad, whether it's a family member, coach, teacher, they should be able to communicate their concerns so that those adults can help them get the right care they need to.
Absolutely.
So.
Dr. Morris, wish we could spend more time with you this morning. Hope to have you back soon, but we appreciate your time with us this morning, a very important topic. And for more information, you can head to the information listed there on your screen. Again, Dr. Andrea Morris from Baptist Medical Group Columbus Children's Clinic. We'll be right back after this.